Hi, my name is Debbie Garcia. I'm an FFP student at the University of Texas at El Paso, and I'm going to be doing a video on the HEENT assessment. And this is my volunteer, Joe. So first, I would go in and wash my hands, and I would greet my patient, and then I would start my assessment with his hair, which I would be assessing for quantity, distribution, and texture, which he is bald, but I am able to see the shadow of his hair, and everything looks even. His scalp, I assess it and for any lesions, any lumps, or any baldness, tenderness. Do you feel anything?
Oh, ma'am.
Okay, then I look at the skin. It's normal pigmentation, texture, and his hair on his face is also normal. And is there any tenderness noted?
No, ma'am.
Okay, everything's normal in color as well. His face is symmetrical. The nose, I do notice it a little deviated to the left. There is no edema noted, no masses, and no involuntary movements. I'm going to palpate his lymph nodes for any tenderness, any swelling, any abnormal signs. No tenderness?
No, none.
Next, I'm going to assess his eyes. I'm going to do the visual of confrontation. If you can cover your left eye.
My left eye, yes, ma'am.
Okay. Tell me when you see my finger.
There. 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 There.
Okay, can you cover your other eye?
Yes, ma'am.
Tell me when you see my finger.
There. 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 There.
Okay, and that's all normal. Now I'm going to check for the positional alignment of your eye. There's no protrusion or deviation. Okay. So now I'm going to look at the eyebrows, and on the eyebrows we do check for any lesions or edema, for the fullness of distribution. And on the eyelids, we look at the eyelids and the eyelashes. Same thing. No lesions, no edema. I'm going to look at the lacrimal apparatus. And I don't see no dryness and no swelling. Do me a favor, look up. Okay, I do see some redness that is noted. And then I'm going to look at the cornea, iris, and the lens. I do not have I do have the appropriate tools, but I do not have them charged well enough for the light to be strong enough to look at the eyes. I'm going to be using the flashlight to my phone. So just look straight at my nose. Everything looks normal. The pupils, the size and the shape are normal. They're symmetrical. The reaction to the perla is what I'm going to do next. The reaction to the eye. Looking for perla. Look straight at my nose. Okay, both eyes are perla. I'm going to look at the extraocular muscle movements. And for this, I'm going to use my pen. You're going to look at my pen and follow my pen, okay?
Yes, ma'am.
So he's going to have to follow. Okay. And for this next one, I'm supposed to use the ophthalmoscope to look at the optic disc, the cup, and the retina. So we would be using this, but my light is not working as it's very low in battery. So usually what we do, we just look. I would use my left eye to look at his. right? We would do this. And then I would do the other one, the opposite. Use my right eye to look at his right eye. Okay, the next step would be the ears. So on his ears, I would be looking at the outer of the ears for any deformities, any lumps, pits, or any skin lesions. I would palpate for any tenderness. Do you have any tenderness?
No, ma'am.
Okay. And then I would check, the next step would be to check his ears. Again, I have no battery, so no light, but what I would be doing is I would be checking inside of his ears, looking to see if there's any ceruleum, any discharge, or any foreign bodies. On an adult, you do pull back and up and back. Okay, we will look in there for any swelling, any redness, discharge, and we would do it on both. We would also be looking at the tympanic membrane. It would be normal in color. We assisted earlier the contour and looking for any perforation. Okay, another thing is I'm going to do the whisper test. So I'm going to be whispering something on his ear and he's going to repeat, and it's going to be done to each side, okay? So I'm going to say a word and you repeat it.
Banana. Bread.
Good. So he repeated both and he did repeat them appropriately. So now we're going to move on to his nose. I'm going to say the anterior and inferior surface of the nose. It is a little deviated, and I mentioned that earlier, but there's no deformities or no tenderness or obstruction. We did look inside with the light, and there was nothing, no obstruction. He did have a slight polyp to the left, but it was barely noticeable. Okay, and with the same light, we would be assessing for the nasal mucosa, the septum, and the tubercles. There was some deviation, again, to the left. Besides that, there was no ulcers noted. Now we do move on to the frontal sinuses, and we do palpate for any tenderness. No?
No.
Okay. So there's no pressure, no fullness. Next, I'm going to move on to the mouth. And I'm going to use gloves for this one. So I'm going to assess the lips. There is pink in color. When I do look inside, they are moist. I don't see no lumps, no ulcers, and no cracking. I'm going to look at the oral mucosa. Can you open your mouth? I'm going to use my phone so I could really look in there. Okay, I don't see no discoloration, no ulcers, no nodules that I can see, and no white patches. So there is no need for me to palpate any further, as I didn't find none of those abnormalities. Next, I'm going to check for his gingiva. So I'm going to touch your lip. I'm going to open your mouth. I don't see no ulcers or swelling. I look up. No, I'm trying to look up. Okay, yeah. See no ulcers, no swelling. And I look at the gum margins. They're all same thing. No swelling and no ulcers. Okay, now I'm going to look at his teeth. If you can show me your teeth. There's none missing, no discoloration, but there is a misalignment towards the bottom. Okay. I'm going to assess the roof of your mouth so you can open your mouth. I'm looking for any nodules, discoloration, ulcers, any redness. Nothing is noted. Can you lift up your tongue? Okay, there's nothing. Same thing, no ulcers. Okay, put your tongue down and say ah.
Ah.
Okay, the ova does the vagus nerve does rise, or the ova does rise when you say ah. Okay, and I have completed the assessment of the HEENT. Thank you.